Why are Americans paying up to 15 times more for weight loss medications like Wegovy and Ozempic than other countries? In a fiery Senate hearing, Bernie Sanders confronted Novo Nordisk's CEO, demanding answers about the skyrocketing prices and lack of transparency. Please tune in to hear how Sanders and the Help Committee gave them hell and what it means for the future of drug pricing. Welcome back to The Downsized. I'm Christopher Durham, and this channel is a joint effort between my wife, Laraine, and me. Together, we've been on a weight loss adventure, shedding over 120 pounds with the help of GLP-1 medication. If you're interested in staying up to date on everything related to GLP-1s and want real first-hand stories, then be sure to like this video and subscribe to our channel. Laraine and I share our personal experiences and break down the latest news and insights. So please hit that subscribe button so you don't miss a thing. We'll be discussing today's Senate hearing on the high costs of GLP-1 medications in the United States. This hearing could significantly impact our viewers and the entire GLP-1 weight loss community. This morning, during a grueling and at times contentious 2-hour hearing, Lars Fruergaard Jorgensen, the CEO of Novo Nordisk, testified before the Senate in a hearing led by Senator Bernie Sanders. The focus of the hearing was the skyrocketing prices of Wegovy and Ozempic, GLP-1 medications that have revolutionized the treatment of obesity and type 2 diabetes. But despite their life-changing potential, the high price tags have put these drugs out of reach for many Americans. This is a very personal issue. Laraine and I have been on our own weight loss adventure using GLP-1s, and we know how impactful they can be. But we also know how hard it can be to afford them. Many of you in our community are either using or considering GLP-1 medications like Wegovy or Ozempic. Still, the high costs can make this seem impossible without proper insurance coverage. So what's behind these high prices, and why do Americans pay so much more for these medications than people in other countries? I'll leave a link in the description if you'd like to watch the entire 2-hour hearing. So let's start with key takeaways. There's 4 of them. Number 1, high drug prices in the U.S. I don't think anybody's surprised by this. During the hearing, one of the most striking revelations was the enormous price disparity between the U.S. and other countries. We've talked about it a number of times on the channel. Senator Bernie Sanders did not mince words on this.
The issue that we are discussing this morning is not complicated. It has everything to do with the chart behind me, which shows that Novo Nordisk's diabetes drug, Ozempic, is sold in Canada for $155, in Denmark for $122, in France for $71, and in Germany for $59. In the United States, Novo Nordisk charges us $969, over 15 times more than they sell that product in Germany. Wegovy, Novo Nordisk's weight loss drug, is even more expensive. As the chart behind me also shows, Wegovy is sold for $265 in Canada, $186 in Denmark, $137 in Germany, and $92 in the United Kingdom. In the U.S., the list price for Wegovy is $1,349 a month, nearly 15 times as much as it costs in the United Kingdom. What we are dealing with today is not just an issue of economics. It is not just an issue of corporate greed. It is a profound moral issue. Novo Nordisk has developed game-changing drugs which, if made affordable, can save the lives of tens of thousands of Americans every year and significantly improve the quality of life of millions more, if made affordable. If not made affordable, Americans throughout this country will needlessly die.
This hits home for many in our community. These medications are a vital part of our weight loss journeys, our adventures, and for some, they're the only effective tool in battling obesity or type 2 diabetes. However, the high cost presents a massive barrier, especially for those without comprehensive insurance coverage. The fact that Americans are paying more than 15 times the price of these drugs compared to patients in other countries is something that simply cannot be ignored.
All we are saying, Mr. Jorgensen, is treat the American people the same way that you treat people all over the world. Stop ripping us off.
Point number 2 is our overwhelmingly complicated healthcare system. So why are these drugs so expensive in the United States? The answer lies in the complexity of the United States healthcare system, filled with middlemen who all take a cut. One of the most prominent players in this system is the pharmacy benefit managers, or PBMs, which play a significant role in setting and negotiating drug prices. Lars Jorgensen, the CEO of Novo Nordisk, explained that the list price of their medications is merely a starting point. It is not our intention, he said, that anyone should pay the list price. The list price is the starting point for our negotiation against the PBMs and insurance companies. However, even with these negotiations, many patients still face high out-of-pocket costs, especially those without solid insurance plans. Laraine and I have coverage, but it does not cover this sort of medication. It does not cover any weight loss medications or GLP-1s. PBMs, which are meant to negotiate better prices on behalf of the insurance companies, also take a significant chunk of the profits.
PBMs and their insurance companies, or I think typical insurance companies that own the PBMs and a number of legal entities set up to extract fees from the US system. They are rewarded based on list price, so they get a fee based on list price. So the higher list price, the more fee they get for the same job, which means that in our experience, products that comes with a low list price get less coverage, it's less attractive, and that becomes troublesome for patients because patients who do not have insurance or have high deductible plans are then asked to pay the list price. We pay on average 74% in rebates, discounts and fees, and even more when we are into Medicaid, 340B, etc. So if we did our business based on net price instead of list price, that would mean that our products would be much more affordable for patients. And if we simply paid the PBMs a small fee for the limited risk and contribution they make, I think patients would be significantly better off.
So for every dollar that you sell in medicine, how much of that dollar goes to rebates, fees, and discounts that largely do not get passed on to the patient?
Yeah, for every dollar we make, we give 74 cents to the PBMs, insurance companies.
So 74 cents of every dollar.
PBMs are certainly a huge, huge part of this, but it starts with the drug companies. So the drug companies, the PBMs, the distributors, the drugstores who are selling them, there should be complete transparency. We should know what's going on here.
Now, it's important to note that while drug manufacturers play a significant role in determining the cost of a drug, the problem is greater, it's more complex than the actions of any one industry. So we need to make a serious effort to navigate the network of perverse incentives throughout our healthcare system, including taking a substantive look at health insurance benefit designs, price transparency, regulatory barriers, and the perverse effects of government discount programs have on prices that Americans pay at the commercial market. This committee has a long history of engaging in real bipartisan efforts to lower the cost of healthcare. Last year, Chair Sanders and I worked on the PBM Reform Act to address misaligned incentives affecting PBMs to lower the price patients pay for their prescriptions. The committee passed this legislation with overwhelming bipartisan support. By the way, we need to get this across the finish line and signed into law. And this is the kind of bipartisan work needed to tackle the high cost patients face for GLPs.
For our downsized community, this system of middlemen complicates an already difficult situation. Even with insurance, you may still face high premiums or high deductibles, and those costs only increase when intermediaries are profiting from the system. As Senator Sanders put it, prescription drugs in this country must be affordable, and we must not be forced to pay higher prices than people in other countries for the same exact product. Our third point, corporate responsibility in public health. Beyond the financial implications, the hearing also touched on the moral responsibility of pharmaceutical companies and the impact high drug prices have on public health. Senator Sanders made it clear that the consequences of these high prices are not just economic. He said if the price of Ozempic and Wegovy are not substantially reduced, many patients, especially lower-income Americans, will be unable to afford these drugs. Some of these patients will unnecessarily die.
I remain deeply concerned that pharmaceutical companies continue to put profits over patients. Patients deserve access to affordable prescription drugs.
These words ring painfully true for those who use GLP-1s to battle the disease of obesity. Many people who could benefit from these drugs cannot afford them, and that is a tragedy. The fact that tens of thousands of lives could be saved each year if these medications were made affordable is a stark reminder that this isn't just a financial issue. It's a public health crisis. Number 4, negotiating drug prices. One solution discussed during the hearing was the potential for better negotiations between pharmaceutical companies and PBMs to lower drug prices for consumers.
Certainly, we're seeing PBMs come here and they point the finger in one direction, and the large pharmaceutical companies point their finger in the other direction. I think most Americans hear that as a hustle, as a rigged game, and they're pointing, get it out of here.
However, Senator Bill Cassidy raised a critical point about the balance between profit and innovation. Without a profit motive, it's unclear that these drugs or any drug is going to be developed. This raises an essential question for the entire pharmaceutical industry and honestly for the entire American healthcare system. While the development of life-saving medications like Wegovy and Ozempic requires significant investment in research and development, a balance needs to be struck between maintaining profitability and ensuring that these drugs are accessible to those who need them the most. Innovation should not come at the cost of people's health or lives. There are other ways to do this. There are examples in our own history of our government, of our corporations working together to solve problems. Whether it be the national highway system or the space race, it doesn't really matter. There are better ways to do this. And certainly with a public-private partnership, the opportunity to significantly impact public health exists. There's a better way to innovate, and we have to be exploring it. For our viewers, this is a critical issue. We all want to see continued advancements in medications, but not at the expense of affordability. If these medications remain out of reach for millions of Americans, then the system is truly broken. So let's talk a little bit about innovation versus affordability. As the hearing continued, it became clear that the balance between pharmaceutical innovation and affordability is a recurring theme.
One of the tensions here that I mentioned is innovation versus the ability to afford. And I just want to, echo what Marshall and Romney said. The fact that y'all and others are doing research on the impact of these drugs to prevent Alzheimer's is fantastic. I mean, this could possibly be part of what makes Alzheimer's less of a scourge. And that takes money. So when someone says they can produce it for $5, yeah, they can produce it for $5, but they're not going to produce the $30 billion worth of research that would find another indication for how we go forward. So I think we need to acknowledge there is that. But it is my impression that the United States is paying for this research and that the other countries are not. I'm sure that Chairman Sanders asked if you're making money in Germany. Of course you're making money in Germany. You're making money on the margin, but I don't think, it's my impression, if you will, that it's not the Germans who are paying for the ongoing research as to another indication.
Novo Nordisk, like many pharmaceutical companies, argues that the high costs are necessary to fund further research and development. But Senator Sanders and others question whether those high prices are genuinely justified, given pharmaceutical companies' vast profits. This is a critical point for us. We have repeatedly reported on the billions of dollars in profits these companies are making. We absolutely want them to be able to make money, but there is a point to which you are taking advantage of your customers. We all want continued innovation. Medications like Ozempic and Wegovy are already showing incredible results in terms of weight loss and managing type 2 diabetes. But at the same time, there needs to be a conversation about how to make these drugs more affordable to everyone, not just those with the best insurance or the highest incomes. This Senate hearing has continued a critical conversation about why Americans pay so much more for life-saving medications than people in other countries. For those of us in this downsized community who rely on these drugs for our weight loss adventures, the stakes could not be higher. We need a healthcare system where these life-changing medications are both affordable and accessible for everyone. As Senator Sanders said during the hearing, the time is now for transparency and change. We must push for a system that focuses not only on innovation, but on ensuring that the benefits of these medications reach everyone who needs them without financially ruining them. The focus must shift toward lowering patient costs while maintaining the innovation that brings these medications to market. That means holding pharmaceutical companies accountable for high prices and recognizing the role of PBMs and other intermediaries play in inflating these costs. As Jorgensen admitted, the profit split between the two, Novo Nordisk and PBMs, is part of the problem, which needs to change. We at the Downsized are no fans of PBMs, and honestly, it's a whole subset of the healthcare economy that I don't know that it even needs to exist. They don't actually innovate. They don't create anything. They're this in-between thing that is theoretically negotiating cost, and it's really just adding cost. So we're not a fan of the PBMs at all. What we are a fan of is encouraging innovation and growth and development, and we want Novo Nordisk and Eli Lilly and anyone else out there doing this to have every incentive to do it. We also believe there is an opportunity for public and private partnerships to do this better, and honestly, for our country to lead. We would love to see Bernie and the rest of the Help Committee also call Eli Lilly to the stage. Put them to the task too. Give them that 2-hour, pounding and say, what the heck is going on with your prices? Where are we going with this? How are you helping? How are you a part of the solution and not just driving up cost? We firmly believe the future of American healthcare rests squarely on the shoulders of GLP-1s. Is it a magic pill? No. Is it a solution for everything? No. Is it a huge part of the future of healthcare? Absolutely. It's changed my life, it's changed Laraine's life, and it's changed many of yours. That's the story for today. We'll keep reporting. That's it for today's episode of The Downsized. If you found this discussion helpful, please do not forget to like this video and subscribe to our channel to stay updated on the latest GLP-1 news and our weight loss adventures. Laraine and I deeply appreciate your continued support as we tackle these critical issues. We'll see you next time. I'm Christopher Durham for The Downsized.